If you have a disc between C5 and C6, it will cause pressure on C6 nerve, and consequently, you will have a C6 radiculopathy. What are the signs of a cervical disc herniation or a cervical disc disease? The main sign is paresthesia or numbness or tingling or reduced sensation in the upper limb, and also weakness. All right. So weakness, reflexes, and numbness. These are your basic upper limb neurological examination. The location of the impingement. It usually occurs laterally in the spinal canal at the level of the disc space, just proximal to where the nerve exits. And we talked about which nerve root is usually affected by a disc herniation. So we talked that the first cervical nerve root is above its named vertebra. So it's above C1. So it's basically between the occiput and C1. The second nerve exits between C1 and C2. And the third nerve exits between C2 and C3. So as we mentioned, you can discern that it's usually above pedicle. The eighth nerve exit between C7 and T1. So it's not going to be its named pedicle here because you only have 7 cervical vertebra and you have 8 cervical nerve. The anatomy dictates that a herniated disc between C3 and C4, that will mean that the C4 nerve root will be affected. So the corresponding nerve root will be affected. This is the anatomic background to understand about the disc herniation. So we talked about which nerve will be affected. Herniation, the location of the disc, which usually happen laterally on the spinal canal and just proximal to where the nerve root exits.